Hello and welcome. Cancer Council New South Wales acknowledges the traditional custodians, both past and present, of the lands on which we work and live. Tonight we invite you to come together and talk about the things you weren't expecting following your cancer diagnosis. Before we get started, I would like to take you through some housekeeping issues to make this event as seamless and interactive as possible. During the webinar, if you would like to ask either the panel or myself a question, please use the chat facility located in the bottom left-hand corner of your screen. You can also post comments, ask technical questions, or share information between yourselves. To protect your privacy, you will not be able to see who has logged in tonight, but in the chat area you will see a first name and the initial of your surname. If you experience any difficulties hearing the sound throughout tonight's event, please feel free to listen via the telephone by dialing the 1800 number provided in the chat box and then enter the passcode provided. We will also be launching some interactive polls throughout tonight's event. These are anonymous, so please feel free to participate. During the last 15 minutes of the webinar, we will answer some of your questions addressing the most commonly raised themes. And also, today's event will be recorded and everyone who registered will be sent a link to view a copy of the recording. So please don't worry too much if you get distracted by the chat, as you can watch the presentation later. If at any stage you need to speak to someone urgently, please do not hesitate to contact a Lifeline counsellor on 13 11 14. This support is available 24 hours per day, 7 days a week. So let's get started. Firstly, I would like to introduce our panel. Kim. This is Kim's third webinar with us, so she's an expert now. Isabel, Jeanette, and Yvonne. I'm Jill Mills, and Annie Miller, the manager of the Practical Support Unit, will be monitoring the live chat tonight, so you can say hello to her in the chat box. So let's get started. So the things you weren't expecting. So I always have a little look at the research before we do these webinars and see what's around. So it seems that, women's experience of breast and gynecologic cancers, I always struggle with that word, is both unique and complex, affecting many aspects of your lives during and after treatment. Physically, for breast cancer patients, there are many common side effects. Upper extremity motion restriction, lymphedema, fatigue, weight gain, pain, and chemotherapy-induced peripheral neuropathy. Did I say that right, Kim? Neuropathy, sorry. Some women say that they were uninformed regarding these side effects and often surprised that they do not always disappear after treatment. And whilst rehabilitation and exercise are effective in preventing and managing many physical side effects of treatment, not all women are referred to rehabilitation or assessment. And many gynecological cancer survivors experience problems with their close relationships. They may also experience unexpected physical complications, not getting back to normal, emotional pain and isolation, lack of available information, and inadequate healthcare provider responses to treatment complications and sexual relationship problems. Women's stories reveal that many sexual and intimacy issues remain within a culture of silence. So often we hear this, if they told me I didn't hear it, they told me but I didn't grasp what that would mean for me, and I thought everything was going to go back to normal. All of this was really a surprise for me. So there are some common quotes that we tend to hear. So our first polling question, here it is here. So feel free to participate. Can you relate to any of these unexpected issues that I've just brought up here tonight? So please feel free to vote yes, no, or some of them. And we'll just hold that up there for a minute or so. Not sure how many people are logged on so far tonight. There's about 32 of you apparently. Okay, fantastic. Thanks, guys. Girls, I should say. So now I'd like to introduce Kim Hobbs. So Kim, here we go. And so Kim's going to give health professionals' perspective of the unexpected. So over to you, Kim.
The slides aren't moving. Sorry, after that little delay. Lovely to be with you all again. So my brief here tonight is to raise some of the issues that I hear repeatedly from women that I see in clinical practice as a social worker. The good, the bad and the ugly of the aftermath of a cancer diagnosis. And yes, we're going to finish up with some of the good things that can happen that follow the cancer illness experience, because it's not all doom and gloom. But in the beginning, everybody around you is exhorting you to be strong and optimistic. You may have a whole lot of unexpected things happening that make you feel anything but strong and optimistic, but that you can't ask someone. I'm not the expert here. The real experts are the women who will follow me, the women who've experienced, as have many of you, the upheaval that comes in the wake of cancer treatment. But what I know from my clinical practice is in the turmoil of those very early days when you've confirmed a cancer diagnosis, there's a whirlwind of appointments, investigations. Some of them are painful, many of them are scary. There's waiting and waiting and waiting. There's delays and then, another round of tests and biopsies. And then finally, an avalanche of information about diagnosis, stage, treatment plan. That might be surgery, chemotherapy, radiotherapy, hormone therapy, or all of the above. You might experience some hair loss, nausea, fatigue, lymphedema. Maybe there'll be some talk about prognosis and maybe about clinical trials. So it's a pretty hazy time there that follows, with mountains of facts, figures, statistics and information booklets. But a whole lot of questions often don't get asked and answered. What does this mean for me as a person? How will I be at the end of this treatment? How will I look to others and how will they see me? Will my partner still find me attractive? Will I be able to engage in an intimate relationship? Will my children be frightened of me or alienated from me? Will I be able to work? Will I be able to do the things that I was doing before, the things that people don't think about, like looking after my frail aged parents or my sister or brother with mental health problems, or the small children in my family, be they mine or my nieces and nephews? How will I be physically, emotionally, psychologically? What are the long-term consequences and side effects of treatment? What about my family and friends? What do I say to them? How can I maintain my social roles? How do I continue to be a lover, a mother, a daughter, a colleague, a friend, a confidant? I don't want everybody seeing me as just a patient in need of help and sympathy. But if I'm not managing, where do I go for help? Do I dare to even admit that I'm not coping? What will people think of me if I say I'm struggling through this experience? Don't I have to think positive and be brave to recover from this horrible illness? I need someone to talk to who's not emotionally connected to me. I want to be hopeful. I want to believe the treatment will work, but I also want to be able to express my fears and to discuss my worries. What will my medical team and my loved ones think of me if I dare to state that I feel frightened or depressed or anxious, if I don't feel like I want to go on? Will they think I'm crazy? Will they think I've given up? Will they think I'm not grateful for all the help I've been given? So there's no denying that in those early days of cancer, most of the experiences are negative. And yet those around you will still be wanting you to see only the positives. So they might be saying things like, gosh, you should be grateful you're getting the best treatment in the world. You've got people around you who love and care for you. And so it makes it really quite hard to acknowledge that you don't like what's happening to you and that you're worried about your future. So let's look for a moment at the things that are bad and ugly. Being grateful to be alive just doesn't cut it when you don't like what you see in the mirror. Even when those who love you tell you it doesn't matter that you look different, maybe you have no hair, maybe you've lost or gained a lot of weight, or you have an unsightly scar or a stoma, or you've had a breast removed, or you've got some sort of implantable vascular device. Maybe you're having difficulties maintaining your intimate relationships because your libido is low, or you have pain or fatigue, or you've been catapulted into an early menopause. Maybe you're worried that your partner no longer finds you sexually desirable. Maybe you had plans for having children or more children, and that's now been irrevocably altered, or at least it will require complicated reproductive technology to come to fruition. If you have trouble with your arms and legs with lymphedema, then they're disfigured and heavy, and it prevents you from performing your normal duties, and you think you look ugly, at least in your eyes, no amount of reassurance from people around you that you're still the same old you is going to help. It's difficult to accept offers of help from others. Women are so good at being the ones who provide care and nurture. If they're suddenly in the position of needing that care and nurture, it's quite hard to accept, especially if that comes as well with financial dependence on others as a new thing. And so sometimes, no matter how favourable your prognosis, you're fearful of the cancer coming back to the extent that it impacts on your ability to resume your normal roles and plan for your future. Depression in the general community is quite prevalent. We expect some women with cancer. It's hard to know, and it's hard to give an estimate, but it might be up to around 20%. We expect some women will develop a clinical depression that requires treatment with therapy and or medication. If you've had a depressive illness in the past, you may be more susceptible now. Recognise the symptoms and seek help, because depression is treatable. We don't have to put up with it. And if your cancer is related to or is suspected to be related to a BRCA1 or 2 mutation or to the Lynch syndrome, you may experience overwhelming sadness, grief and guilt about the potential for passing on this mutation to your offspring. So seek out the support and guidance of a familial cancer service. But I want to finish my little bit tonight with some of the more positive things that happen. So I don't want to minimise or trivialise the challenges confronted when you're dealing with a cancer diagnosis, but many women talk to me about the positives that come from the unexpected outcomes in their lives after cancer treatment. Accept those offers of support. That can be difficult, as I've said. In our society, women are typically the carers and the nurturers in families, friendship networks and the community at large. Acts of kindness and generosity are often unanticipated and can be very humbling. Friendships forged in times of hardship can be especially important and enduring. Women frequently say that they didn't realise how many true friends they had. Yvonne's going to talk much more about accepting offers of help, but bear in mind that those who are offering you to help will feel better if you accept their offers. They'll feel that they're contributing to your overall well-being. And after all, wouldn't you do the same for them if the roles were reversed? It's not unusual for women to reevaluate their priorities after cancer. Do you really want to continue in a relationship that's no good, or a work situation that's unsatisfactory? Finding that you have the courage to make major life changes can be very empowering, even if it's a little bit scary to do. And finding purpose is something that gets commonly reported to me. That sense of awareness that you can do something meaningful. It might be fundraising, it might be peer support, it might be a major lifestyle change. I don't much like the term wake-up call. It's a bit of a cliche, but it's embodied in that notion of seizing the moment and not putting things off until tomorrow. But I think you've probably heard enough from me from now, so let's hear from the real experts.
Thank you, Kim. And we have the next polling question. So from what Kim was saying, do you think that you would be able to implement some of the ideas which Kim has suggested? Please feel free to vote. We're getting pretty good resounding yes, I think. So thanks, everybody. So now we'll move on, and Isabel's going to tell her story now. Welcome, Isabel.
Thank you for having me. I was asked to talk about my experience with cervical cancer. This journey I've been on for the last 6 years involves much more than a cancer diagnosis and cancer treatment. It bears many layers, some of which I will share with you today, as I feel they have shaped the person that I am and they relate to my survivorship. The most difficult part in telling my story is always to summarise it. Conveying my real experience in less than 10 minutes is nearly impossible, so forgive me in advance for glossing over certain elements. In sharing, I hope to give you some insights as to what was helpful and not so helpful for me. I hope to also give you some hope that from a lot of pain can come a lot of good, even though it is hard to believe at times. I was 33 and had been in Sydney for nearly 9 years at the time of my diagnosis. My type of cancer did not have a genetic component. I think that for anyone facing such an illness or anyone supporting a person who is, it can be useful to reflect on the factors that may have suppressed your immunity or your disposition to remain healthy. In my case, it goes like this. A few years before my diagnosis, I had experienced high levels of stress completing and handing in my PhD. I otherwise considered myself very lucky. I was healthy, had a very consuming but very successful career, a loving partner, and some great friends. I did enjoy living in Australia, although my time here was meant to be short-lived. Not having family around was very difficult at times. My partner and I were planning to relocate to our home country at some point, which made the distance a little easier to bear. The year preceding my diagnosis had been extremely difficult, both physically and emotionally. I fell pregnant, and during that time I lost my own mother to cancer. My daughter was born 8 months after her passing. I had an uncomplicated pregnancy, but a long, difficult labour, which left me with severe postnatal physical complication. My physical health was slowly getting back on track. I was planning my return to work. A few weeks before my scheduled return, my position was made redundant. I felt devastated as this was a job I loved and had invested a lot in. A few weeks later, I received a letter from the Pap smear register reminding me that I was slightly overdue for a Pap test. That testing day came soon enough, and I was expecting nothing less than a routine test. I knew something was not quite right when I was on the examination table for what seemed like an insane amount of time. Towards the end of the examination, the doctor who had examined me called a more senior colleague. They both sat with me at the end to explain their findings. The first question they asked was whether I had anybody there for support that day. Of course I hadn't. They then quickly offered me, they offered to call somebody for me and rang my partner at work for him to come in. What happened next now seems like a blur. I remember being there for hours and not being able to stop crying. I heard words like aggressive form of cervical cancer and probably, or most likely, rapidly progressing. At that point, I switched off. It felt like my whole world was imploding. There is some truth to the saying that when you hear the word cancer, you see death. I was in shock. Was it possible? Me? How did I not see this coming? I had essentially been cancer-free. Oh, sorry, not cancer-free. I had essentially been healthy until then. Never smoked, led a healthy lifestyle. Did I really work hard all those years to get somewhere in life, only to be told there might not be one? My mind was racing ahead. I was thinking, how long do I have? What will I do with the remaining time I have? Will my child grow without a mother? I was also thinking about my mom, who about 2 years earlier had probably sat in a similar conversation. I started reading everything I could find on my type of cancer, as if gaining some knowledge and understanding would give me some control over something I literally had no control over. That is how I processed things. Then I heard some uncertainty. The diagnosis was unclear and needed to be confirmed with surgical procedures. Perhaps that was my own way of being in denial of what was happening. With that came a little shred of hope. I might be able to live and have more children after all, like I always envisioned I would since I was a little girl growing up as a single child. Within 3 weeks of my examination, I had been put under general anaesthetic 3 times, had 3 surgical procedures, and was starting to call the hospital my second home. The third and last procedure was a radical hysterectomy, which kept me in hospital for 8 days and removed my hopes and dreams of ever bearing a child again. When I woke up from my last surgery, the first thing I remember is hearing the cries of a newborn baby. Somebody had just had a cesarean, and the nurses had rolled the bassinet and the baby right next to me. I guess this was not unusual given that I was in a maternity hospital, but I had not expected to be confronted to this so soon. It was like some higher forces had conjured up a bad joke, as if telling me, here's what you can't have. Better get used to it now. I just wanted to wake up from this horrible nightmare that had been the last month of my life. After my surgery, I was told I was lucky. The surgery had been a success. I was literally termed cancer-free. None of my lymph nodes were involved, but because of the size and spread of my tumour, I needed a course of radiation. The treatment would permanently damage my remaining fertility. My ovaries had been preserved, and so we were given a 6-week window of opportunity to complete an IVF cycle in an attempt to possibly have further children through surrogacy. My partner and I had already begun trying for a second child, so this seemed like a logical step if we wanted more children of our own. We met with fertility specialists and started the IVF cycle. 3 weeks later, on Mother's Day, and quite unexpectedly also, my partner decided to end our 7-year relationship. Very quickly after that, he engaged in what was going to be a relentless custody battle, which lasted over 3 years. I will spare you the details of this horrible part of my journey. Let's just say that at the time, it felt like my life was spinning out of control and that all my energy was going in the wrong places. Life became a daily struggle and I plunged into a severe depression. My grief became impossible to bear. I had to grieve not just my health anymore, but my relationship, my hopes and dreams of ever relocating closer to family, and quite possibly my dream of having another child of my own. I had not signed up for this. None of it was part of the plan, my plan. I was very lucky that psychological support had already been initiated through the hospital around the time of my surgery, and so adequate referral was made quickly when my world turned up into chaos. Whilst continuing my own counselling support, I started attending a support group regularly. I was lucky to have found a group of women with similar diagnoses, although I found it easier to relate to those members of the group who were closer in age to me and faced similar challenges like having young children and losing their fertility. I was lucky to have some great friends around who stepped in and helped tremendously. Without them, I would not be here today. It's true that in circumstances like these, you discover who your true friends really are. It's also true that quite often people would like to help, but they just don't know how, and it's not always easy to ask. I certainly did not find it easy. Thankfully, a good friend of mine offered to coordinate the logistics of help over a certain period for me. She would, for example, solicit help to drive me to and from the hospital, organise care for my daughter when I was physically unable to do so, solicit help with meals to help me through the week, all the practical little things like that. Daily mindfulness meditation was very helpful around that time. I'm a highly anxious person, so it helped me manage that better and allowed me to see that no matter what, or no matter how bad life can be sometimes, you can always find something to be thankful for. I would go for walks with my daughter and she would remind me of this constantly. She would comment on how beautiful the flowers were. She would giggle and chase birds at the park. I would in turn learn to appreciate those moments, however fleeting they were. I remember being grateful for the pleasant sensations a simple walk would bring, the sun on my face, the wind in my hair. I even got to appreciate getting caught in the rain without an umbrella a few times. I also found a lot of comfort in routine, be it an exercise routine, a morning or bedtime routine, even regular health appointments or anything that was or could be very predictable and structured. Routine gave me a plan, something productive to focus on. My inclination for seeking out information is another thing that continued to help me throughout my cancer journey. I read a lot of inspiring books, learned about the Gawler Foundation, started attending their yearly conference. A lot of hours each week was spent just learning. I decided that I had two options. I could accept that the medical community had saved me from a major health crisis and do nothing further, or I could take an active role in my recovery. I chose the latter and made my health a priority. At the end of the day, I was the best advocate for myself, and if I didn't do it, who would? I became very interested in nutrition and the potential effects of diet on cancer cells. I made several changes to my diet after gaining a fair amount of knowledge. I thought this was a variable I could easily control and that also had a huge impact on health and well-being. At one low point in my journey, my therapist asked me to name one thing that invariably made me feel good. I quickly replied, playing the piano. Strangely, I had barely played since coming to Australia. I had always assumed it was something I would pick up again after relocating overseas. I followed their suggestion of seeking out an instrument and started to play again. Channeling into that creative energy became a therapeutic moment each time, a bit like what practicing a sport or reading a good book can do. Now I'm able to share that passion with my daughter, and I love watching the effect that playing music also has on her. Celebrate the milestones, no matter how small. Whether it was a full night's sleep, the end of treatment, or receiving a good test result, I made sure I celebrated those little successes along the way. When I survived the 5-year mark, I celebrated with a health retreat. Doctors will tell you 10 years are better. That's okay. I'll celebrate them too. I spent more time with people who made me laugh. I was also very lucky that even as a baby, my daughter had this very contagious laughter. She laughed easily and was happy. She was a happy little soul with a very cheeky nature. In a way, that was her biggest gift to me. Amongst the ongoing challenges I've had to face on this journey so far, fertility loss was a big one. So being a single child, I grew up having a very strong desire to have more than one child. And the process of me letting go of that possibility has been my biggest challenge, and one that I still struggle with today. The reality is that I absolutely love becoming a mother, and that subsequently my daughter played a significant role in my recovery. So naturally I wanted to repeat the experience. Some people have said to me, be happy, at least you've got one. Although this is true, I'm so grateful, and I'm really grateful I do. I found these comments most unhelpful in dealing with the feelings that I had. Even though having another biological child was really never a tangible possibility, I wanted to believe it was possible. I was latching onto it as if it could somehow revert the damage cancer had done to me. Lymphedema was a direct side effect of my surgery, although it only appeared about 5 years after my operation. It obviously had progressed over a long period and was, for the most part, not properly diagnosed and managed. My lymphedema is contained in one leg now, although I'm at risk of developing in the other leg. Even if it is considered mild, I have to wear heavy compression garments every day to prevent it from escalating further. So the biggest part of that is, apart from the expensive out-of-pocket medical expenses that it creates, the hardest aspect was to go from something that was quite invisible to now something that is very visible, and sometimes raises unsolicited questions and make you revisit what you may not want to discuss openly. Obviously, adjusting to my new reality as a single parent in a foreign country came with many challenges, including keeping my health a priority whilst working full-time and care for a young child most of the time, as well as dealing with a very difficult ex-partner and the early presence of another mother figure in her life. Adjusting to a new me was another important aspect, from rediscovering sexuality, adjusting to a new body self-image, visible and non-visible signs of my illness, dealing with permanent physical damage from radiation, etc. Sometimes it feels like healing the hurt caused by my relationship breakdown was more difficult than healing from cancer itself, probably because in many ways it steered my energy away from dealing with my health. Learning to love and trust again was still in many ways another big challenge for me. Creating a new vision for the future, also that was very important for me, as for a long time I could not see myself surviving at all. And accepting what is, letting go, which mindfulness helped a lot with. Practicing forgiveness, I find that very difficult, but this is not about forgiving someone or something that may have harmed you, but about cleansing yourself from the bitterness that, of what might have been, what could have been, etc. Frame things differently. So learning to frame things a little differently is another challenge, one which can really be good for highly anxious people like me. This is really about how we approach and view things, and I don't pretend to always be able to do this well, hence it figures in my ongoing challenges section. Cancer is not something I chose. Being abandoned at the worst possible time is not something I chose. When things like that happen to you, they don't only cause a great deal of pain and grief, they're perceived as things you can't control, even though in reality you probably played a part in them happening to you in the first place. So what is the best way to respond to unexpected life events? When I dragged myself to hospital every day for 8 weeks during my treatment, a poster caught my attention and stuck in my mind. I think it encapsulates perfectly the only response I could have had. I hope that in sharing my journey with you today, I've given you some insights that may help you navigate through your journey, no matter what stage you are. 6 years on, ironically, I can say that what happened to me was probably for the best. Sure, I could have done without some of the challenges, but I'm probably stronger for them. I now know that that if I survive all this, I can probably survive a lot of things. I'm of course able to speak of my journey very differently now than when it seemed like everything in my life came to a halt. I'm still cancer-free, but I would not call myself free of cancer. Cancer doesn't stop after surgery, although in my case I was lucky that surgery was considered a possibility as the first treatment measure. I don't really think it fixed everything. Cancer changes you forever. It certainly is a big catalyst for change. I have come to see it as an invitation, as it invited me to make positive changes in my life. It invited me to get to know myself better. It really did remind me that nothing in life is permanent, even the biggest storms, and that if you are patient enough and if you look closely enough, a rainbow will come. Thank you.
Okay, so now the next polling question we'd like to ask. So, do you think that cancer can be a catalyst for change, as Isabel was discussing? So, let's see how you feel about that. Sounds like a yes. Yeah, pretty strong yes on that one, I think. Thanks, guys. So now we'll move on. I'd like to welcome Jeanette, and Jeanette's going to tell you about her experience. Thank you, Jeanette.
Hi, so my name's Jeanette, and I was diagnosed with breast cancer back in 2008 when I was 37, which is relatively young. I had a lumpectomy and then chemotherapy and radiotherapy. 3 weeks after I finished my treatment, my dad was diagnosed with lung cancer and given about 6 months to live, and he ended up passing away just about 4 days after my 39th birthday. So when I was asked to share my story today, the first thing that came to mind about what I wasn't expecting was that nobody really told me that the emotional scars of cancer would be far deeper and last longer than the physical ones. So that's a little bit about what I'm going to talk about today. And, you know, perhaps one of the differences that I experienced with getting cancer at a young age was that my body was able to recover from surgery and chemo and radiotherapy. But emotionally, I was really in a terrible place, and I was just trying to make sense of, you know, this traumatic and unexpected impact that cancer would have, just not on now, but on the rest of my life. And I'd really placed an expectation on myself that I should be happy because I was one of the lucky ones who, you know, was found their cancer, you know, early, and I had a really good prognosis, you know, to live. But I really wasn't happy, and I masked depression for a number of years after treatment. I really went from being a confident, you know, life-loving 37-year-old, had a loving partner, a house, a dog, and, you know, was planning to have a family, to being exhausted, emotionally shut down, anxious, and really wanting to hide away from life. So I couldn't find the old me after cancer, and I didn't know how to move forward with this life. So another thing that happened, which was unexpected, is really pretty much my sex life stopped. Boobs just weren't fun anymore, and my partner actually found my lump, so touching me reminded her of this. And so in this situation, I wasn't the only one that needed to heal. Sure, I had body image issues and, you know, a certain degree of pain, but to my partner, you know, my boobs were scary now, not sexy. And, you know, this just compounded, you know, her fear of cancer as well, because her mother had passed away from breast cancer in 2000. So there was a lot going on. Yeah, then the whole fertility issue came up. Before I had chemo, my oncologist had raised the topic of freezing my eggs, and by saying to my partner and I, so you guys aren't expecting to have children, are you? We were pretty shocked by this. I mean, we were shocked by cancer, full stop, but, you know, to kind of have that expectation that just because we were lesbians, we wouldn't be having children, just really put us into, you know, kind of a situation where we just went, oh, no, 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 you know. But that wasn't really the answer. And even 18 months after my cancer diagnosis, I was so desperate to go off tamoxifen. And to have a baby. So then I approached my oncologist again, and she said, oh, look, you know, we really recommend that you stay on tamoxifen for 5 years. So, you know, I was diligent and I did that. And it wasn't until I was 41 and I was realizing, you know, the body clock was really clicking on, that I just basically said, you know, I've done 3 years of tamoxifen and I want to get tested and see, you know, what the status of my fertility was. So I ended up getting tested, and, you know, it wasn't good. So, you know, maybe it was my age, maybe it was chemo, who knows. But, you know, there were a few options open to us, but none of these really felt right to us. So, you know, we came to the decision of not to have children. You know, thinking back on this, it really would have been beneficial for us to be given counselling at the time of diagnosis, and just being given that space and time around making a decision that would affect the rest of my life. So I was now in a situation where I was grieving the fact that, you know, children wouldn't be a part of our future. And this was, you know, 3 years after my cancer diagnosis. So it really did send me into a depression, and funnily enough, I actually felt a legitimate reason so that I could ask for help. And I hadn't got help before because, you know, physically I was actually okay. You know, I didn't actually have any bad side effects from tamoxifen. And I was only really at that point, up to that point, considering my physical reaction to cancer, not the emotional ones. Not the emotional ones that, you know, were in my face now, you know, like grief and depression, anxiety and fear of reoccurrence. So yes, cancer brings a lot of pain into your life and into the lives of those who love you. But also, you know, what do you do with that? And, you know, with that pain also comes an opportunity for profound transformation, or perhaps, you know, it doesn't give you any other option but to, you know, transform and change your life. So I kind of look at this as, you know, cancer gave me an access all area card to try new things and to do things differently. And a couple of the new things that, you know, I did were to go and see a psychologist. I ended up, you know, doing meditation, having energy healings. I did a whole lot of charity fun runs as well. And I also ended up volunteering for Cancer Council New South Wales. So all of these things started to contribute to rebuilding my emotional wellness. I first started going to the Cancer Council C-Word, which is a support group for lesbians with cancer. And I was so grateful to be able to, you know, have fellow, you know, lesbians to actually talk about the real personal details, you know, of my cancer and fertility issues, you know, with people that really understood. Another benefit of that group was that my partner could come along to this group as well. Finally, she could, you know, start accessing some help for herself as well. And even if her original motivations were just to go along for me. So we'd gone through cancer together, so it was, you know, it made sense to us that we would go through support together. So this introduced me to, you know, basically the cancer community, and then from there I got involved in Relay for Life, which was amazing to see, you know, so much positivity and so much strength in the cancer community. I then started doing a volunteer program with Cancer Council New South Wales called Living Well After Cancer for those who had finished treatment. And again, this just, every time I do this program, I just, you know, have such a privilege to be able to connect with survivors and see, you know, their strength, you know, and their courage. And, you know, I found you know, a real love of connecting with the cancer community. I also started doing charity fun runs. I probably wouldn't have put the words fun and run together in a sentence before I had cancer. And I definitely, you know, hadn't trained for any events before. So this brought something completely new into my life. And I also did pinky triathlons where, you know, 1,000 women get together, you know, and all ages and all sizes and all abilities to run and, you know, swim and cycle and raise money for cancer. So I lost weight, I got fit, I had fun, and I raised money for cancer. It was an amazing win-win. And I also started to regain my self-confidence. Then another thing that happened was a friend introduced me to energy healing, and that really started to have a profound emotional breakthrough for me. This is just a non-touch complementary therapeutic modality which helps people let go of negativity, you know, in the form of all those unhelpful thoughts, all those unhelpful beliefs, a lot of suppressed emotions that I was holding, and, you know, it just really helped me to kind of, yeah, basically get a real focus on, you know, my energy body and my physical body and my emotional body together. And I found that, you know, just even after the first session, I just felt so much lighter, and I felt kind of energized like I hadn't been for so long. So I thought, wow, I'll keep doing this. It's working. It's doing something really positive for me. At the same time, I started a meditation practice, which was a style that's really well suited to busy people, as it works to keep the mind engaged with guided visualizations, affirmations, music, mantra, breathing, and transcendental techniques. I'd done quite a bit of mindfulness meditation before I had cancer, but I actually was really resistant to going and sitting on a cushion and being alone with all those thoughts. So that's kind of the last thing that I wanted to do. But when I came across this style of meditation practice, I found it to be fun and easy, and I was able to get up a regular meditation practice, which has been fantastic for me. So yes, cancer is always unexpected, and the range of emotions and physical challenges that come with it are totally unexpected. But now I just have a whole set of different tools that I use every day to help me feel empowered as a survivor and to help me find a sense of peace in this uncertainty of life post-cancer. So I use these tools of body, mind, and spirit, which support me in my emotional wellness and my physical wellness. And I really believe that these are what are keeping me cancer-free. So I hope in sharing some of my story today that, yeah, maybe you'll put together or have put together, you know, a whole range of things that are helping you through the rest of your life. Thank you.
Thanks, Jeanette. Thank you for sharing your story. So another polling question. So have you or someone you know made beneficial lifestyle changes since being diagnosed with cancer? And I think this is a straight yes, no. I don't think there's any maybes for this one. So feel free to respond. Again, we're getting a fairly high rate of yeses. Thank you everyone. So we will now move on. We're going a little bit over time, so we might we can go a little bit past 8 o'clock, so please stay logged on. So I'd now like to welcome Yvonne. And welcome, Yvonne.
Thank you. Well, today's topic is things you weren't expecting. Well, I wasn't expecting to get breast cancer. I was a 37-year-old mother of one, just going about my life, and then one day I did a breast check and I found a lump, and it turned out to be cancer. I was diagnosed with triple positive cancer in 2011. I had a lot of treatment. I started with surgery, and then I had chemotherapy, radiotherapy. I had Herceptin for a year, and I'm still taking tamoxifen. While I was going through treatment, I started writing my book. It's called One Piece of Advice, and it's a practical help book, and it's based on my experiences and the experiences of other women that I talk to. And I'm not here to talk about the book, but I just want to tell you why I wrote it, and it was because I wanted to help other women who were going through cancer, but it was also because I wanted to capture a lot of the tips that were handed to me and the generosity of the women who passed on that information. So I'm going to, as I said, I'm not talking about the book, but I'm going to follow the chapters of the book today, first of all, just to organise my thoughts, and also because I'm aware that not everybody who's listening is going to have the same path with their treatment. Some people won't have had chemotherapy, some people won't have had surgery. So hopefully by doing it this way, there'll be something for everybody. And I also wanted to just say that I understand that this could be quite an emotive webinar, and that some things I say might trigger different emotions in people, especially where you are in your journey. So at the end there are some resources if you need some more support. So many of you may have seen this picture before. I think it's pretty spot on. That could have been any of us. It was certainly me. I was soldiering on, putting on a brave face sometimes, and I was politely turning down offers of help. And Kim touched on that before. I'm not sure why so many people find it difficult to accept help, but we do. And a big theme when I was talking to women when I was writing One Piece of Advice was that the women in treatment were feeling like they shouldn't take the help. And a big theme of the women who'd finished treatment was saying that you must definitely take the help. From my perspective, definitely say yes. It's a win-win situation. You get help through a difficult time, and cancer treatment can be very, very long. So it's a long, difficult time. And the person helping isn't just sitting around feeling helpless. You know, they're doing something. And Kim, I like it when I have the same opinion as a professional. It's good for everybody. So take help. Specific help is better. If somebody comes up to you and says, is there anything I can do to help? It's really easy to say no. But if somebody says, can I make you dinner next Tuesday, then it's really easy to say yes, please. So if you're going to be offering help, or if you're a person who wants to help, or if you're going to be asking people for help, specific help is much easier. And again, sort of back to Kim's point, is if you're having any difficulties accepting this help, ask yourself, would you do this for somebody else if it was them in the chemo chair, not you? And I think most people would say, of course you would. So the next bit I'll talk about is surgery. And I want to talk about physiotherapy, because physio is often positioned as a nice to have. If you've had surgery, you might get told, well, if you've got any pain, you might want to see a physio, or you could see physio if you like. But it's more important than that. Some of the issues that Jill mentioned in the introduction, mobility restriction, lymphedema, and even pain, can be prevented or mitigated by physiotherapy. Physios give exercises and an education, so yes, it's another thing to do, but you do have to take some personal responsibility for your maintenance. I do have lymphedema. Physio didn't stop me from getting it, but it could have been a whole lot worse. It's a pain, it's not painful, but I had the surgery I needed, and if I had to go back, I wouldn't make any decisions differently, but it just does mean that physiotherapy is a part of my plans going forward. Moving on to treatment. Now, again, I just want to reiterate that I'm talking from a patient point of view, from my experiences, and along with discussions from other women. So I'm not quite sure if this is evidence-based or not, but there's been a lot of discussion that if you've had morning sickness, or if you're prone to travel sickness or motion sickness, then you're more likely to get the bad nausea from chemo. And I know exactly how this feels. But like I said earlier about taking the help, take the remedies. There is medication, and if one lot of medication doesn't agree with you, there are certainly lots of other options. Some women I talked to found that the C-bands that you can wear when you're going on a boat, for example, are very helpful, and you can get those in travel sections of pharmacies. And ginger has been clinically proven to reduce nausea, and the good thing is you can have ginger anything. You can have ginger biscuits, I've got a great recipe, you can have ginger beer, you can have ginger tea, anything ginger will help with the nausea, so that's something that's also got no side effects and is very easy to get. Recovery. So losing your hair is one thing, and I'm not going to talk about losing hair. Not all of you will lose your hair, but it really does feel like a milestone when it starts to grow back. And I remember when I was at the very beginning of my journey, and I went to Soiree, which is one of the Cancer Council supports group, I saw survivors, girls who'd been there, done that, and lots of them were a couple of years on and had their hair back. And I really felt like that was a sign of how well they were doing. And some of those girls really rocked the pixie cuts. They looked fantastic. They told me to expect changes to colour and changes to the texture, and my hair definitely grew back curly. But they didn't tell me that my hair could look like this. Patchiness isn't expected, and I certainly didn't expect that I was going to have a whole lot going on here and not so much going on here, but that was me. It looked like male pattern baldness, so there was certainly a very, very big disconnection between what I was expecting and what might be. The good news is that most people's hair does right itself in time, and this can be frustrating because you're already at the end of a really long period of baldness, but it is a case with this one of just being patient for that little bit longer. My book also has a section for friends and family, but I've also included friends, family, and random strangers for tonight's talk, because I think you really need to be prepared for some of the frankly stupid things that other people might say. People hear the cancer word and they tell you their cancer story, but they don't think sometimes before they speak, and sometimes they might say something that's not really going to have the effect that they wanted. Good intentions can come across really badly, and especially when you're so sensitive and vulnerable. And you'll get both ends of the spectrum. People will tell you their horror stories, and they'll also give you some glib comments like, oh, don't worry, you'll be fine. And neither of these are particularly helpful. My advice is to prepare a couple of responses, a couple of one-liners, so you don't have to think in the moment. I certainly had a couple, but they're probably not appropriate for me to share with you right here. But have something ready. So if you do find yourself in that position, you've got something you can just say. Go easy on your friends. They may say the wrong thing, but they are there and they're there for you. I would rather somebody said to me, you know what, Yvonne, I just don't know what to say, or even if they say the wrong thing. But I'd rather they were talking to me and that they were there than if they ignored me or they just weren't there for you. So go easy on people. And as some of the other girls have talked about tonight, there is some good stuff, which I just want to leave you with. There are friendships that you will form. You will meet some fantastic people, and some friendships that you already have will really be consolidated, and people will tell you they love you and show you in many different ways. Most people will rally, although you can expect that a few people might not be able to cope with it, but most people will rally. If your family is far away, there are other communities that will come forward for you. Cancer Counselling is here for you. If you have breast cancer in your hospital, you'll meet a breast care nurse, and they're fantastic people who, in my experience, always go above and beyond to help you. And when I took part in Cancer Counsel's Cancer Connect program, where I was matched up with somebody who'd been there, done that, for a phone conversation, and I remember in my conversation they said to me, you'll never feel more loved than when you have breast cancer. And I thought that was a strange thing to hear right at the beginning, but it certainly rung true for my experience. So I just want to summarise that for my thoughts. Accept offers of help, see a physiotherapist, prepare for the side effects, be patient with your hair growth, ignore those tales of woe, and feel the love.
Great. So now we'll move on to the polling question. So this is a big one. Did you or do you struggle with accepting help from other people as they offer it? So yes, no, and sometimes this time. So, you know, yeses. A bit of a mixture there. Thank you guys. Great. So now we're going to move on to question time. So we had quite a few different types of questions. Once again, we seem to get a lot of medical questions which we can't really address here. So the other sort of questions you really need to talk to your specialist, oncologist, GP, breast care nurse, whoever it is. So the questions that we have got here. So the first one, and we're going to ask all the panelists to come on now, so you'll get to see and hear everyone again. So I'm not quite sure, maybe this is a question for Kim. So has everyone got their speakers on now? Yep. So how do you become interested in sex? So is that one you want to address, Kim?
Oh, look, that's a huge problem and not very often asked. One of the things that I know from my practice is that people feel like it's one of the more trivial things to ask about. Gosh, this wonderful medical team has cured me of my cancer, so why should I bother them with something trivial like my intimate relationship? And I would say that it's a really important part of your life, and it's one of the things over which you have some control when you don't have a lot of other control over the treatments you're having for your cancer. It's really very common to lose interest in your intimate relationships, and for a whole lot of reasons that I don't really need to tell you about. If you've had a lot of treatment, if you're fatigued, if you have menopausal symptoms, if you're feeling nauseous, and if your body image is not what you'd like, then sex is probably the last thing on your mind. But it is important to talk about the problem. Sometimes it's a matter of communicating with your partner and coming up with new ways of expressing your intimacy. It's a whole other webinar in itself. We could talk about sex. We probably will be at some point talking about that in a webinar. So I think if you are still in touch with your treatment centre, then ask for what help is available there, so whether there's a social worker or a psychologist that you could be referred to. If you're not, I'm sure the Cancer Council helpline might be able to, there's an excellent Cancer Council book that's a good start, and they might be able to put you in touch with someone closer to where you are.
Thank you, Kim. And yes, we will next year be having a webinar about relationships, sexuality and sex. So look out for that one. Thanks, Kim. So the next one, we had quite a lot of good questions, so it was hard to pick out a few. I wasn't expecting lasting fatigue, anxiety, depression, post-chemo, rheumatism and osteoarthritis 2.5 years after diagnosis. How do I adjust my life and work out what my new normal is? So it's a bit of a tricky question. Anyone want to put their hand up for that one? Yes, no? Yvonne's going to speak, I think. No. And remember, yeah, there's no medical advice here, so from our own experience only.
I know from my experiences of what I've been told that exercise can play a really big part in recovery, especially with things like fatigue, anxiety and depression. In terms of rheumatism, osteoarthritis, those sorts of things, I'd say go back to your doctor, and I'd say keep knocking on their door until you've got a few more answers. I mean, you might not be able to be cured of these things, but certainly there's going to be medication or other support to manage the feelings and the symptoms that you get with that.
Yeah. Thanks, Yvonne.
If I can add a small point about anxiety and depression, take all the professional help you can get, really, and be kind and patient with yourself. I think mindfulness meditation was a great help for me, and to not get your mind racing ahead and worry about the worst possible scenario, and yeah, be in the now and appreciate the little things in life which are right there and can be a great source of comfort.
I think there's a big message here. These things are all very normal responses after cancer treatment, but you don't have to put up with them. And so if you tell someone what your problem is and get them to direct you to the help that's available, most things can be improved, maybe not cured altogether, but most things can be improved. But we need to know you have the problem before we can begin to address it.
Yeah, thanks. And that's the whole that keeps coming up, the new normal. It's, I guess the big question, what is normal anyway? So it's a very tricky question and very individual for everybody. So coping with the anger and emotions. Sorry, Jeanette was going to say something.
Just going to say, the program that I do with Cancer Council New South Wales, Living Well After Cancer, actually is a workshop all around, how do I deal with the new normal. So that'd be something that I'd recommend having a look at as well.
Julie's just made a comment in the chat box. Normal is a cycle on a washing machine, my analogy. So thanks, Julie. Coping with the anger and emotions afterwards. So Kim, maybe mention.
Yeah, in our society we're not very good at dealing with the negative emotions. Most of us are pretty good at saying when we're happy and when we love someone and when all's going well, but we're really not very good, and we're not encouraged to be good at expressing negative emotion. And often the people around you who love you the most will want you to express those emotions because there's a lot of unproven beliefs that you have to continue to be unrealistically optimistic and positive, or you might risk your cancer coming back. There is no evidence for that. It's okay to feel angry, it's okay to have negative emotions, and that's probably where you need most of all an external therapist, psychologist, social worker, peer support person, someone where you can say the worst things without risking hurting their feelings and straining your relationship. So seek help outside of your friendship and family network.
Thanks, Kim. The next question, so how do we get a more open and honest conversation going about the full range of potential side effects of treatments so that women have the information they need to make medical, practical and financial decisions? So that's quite a big question, I think.
Yeah, whoever's asked that question has really hit the nail on the head. It's about conversations. Doctors and nurses who treat you are very good at interpreting test results and reading scans and knowing what your pathology says and what the best treatment is, but they're not very good yet at reading minds. And so unless you can initiate the conversation and say, these are the things that are on my mind and these are the things with which I need help, then we can't know it. And I think often people feel like they need to put up that brave front. Yvonne talked about that and had that great photo, that great picture. So instead of thinking that you need to be putting up the brave front, to say, these are the things that are happening for me that are making it difficult. Can you tell me where to get help? Again, the Cancer Council has a whole lot of good resources for helping people get their help, and most of your big cancer centres will be able to direct you as well. And if you get into that trap of thinking, oh, I can't possibly ask all these questions because they're very busy and there's a waiting room full of people and they're very important people who don't have the time, write your list of questions and don't leave until you've asked them all. And if you don't get the answers you need and the directions to be pointed in the right directions for services, then ask again.
Thanks, Kim. And I'm guessing everyone else would agree with that? Yes. So this last one that we've got here, 7 years from diagnosis and treatment, I have changed many things, but only recently left a 27-year abusive relationship. Is this a common thing on the journey? Again, maybe Kim, your work.
It's common, but it's what I was alluding to by saying that sometimes when you have this realization that you've coped so well with a whole lot of difficult treatment and the emotional turmoil, and you've had to as well cope with the emotions of your family and friends, you suddenly can think, I have a lot of courage that I didn't know that I had. And if this is a second chance at life, do I really want to spend it with this person who doesn't treat me well? And so I congratulate the person who was able to do that. It is a great thing to do. I wouldn't want to say it's common, but I think if you have the courage to either get out of a bad relationship or to leave that job or to move on from whatever it is that's causing you grief in your life, it's a great thing to do. And I can tell a very funny anecdote of being out Christmas shopping a few years ago with my sister. And we were shopping in a big shopping centre, and a lady came and tapped me on the back and said, hello, do you remember me? And I said, oh, yes, I do. And she was someone that I knew from work. And she said, I just thought I'd have to tell you that I finally got divorced last year. And I said, that's fantastic. Good on you. And my sister looked completely puzzled because without knowing the context, she couldn't work out why I was congratulating someone for getting divorced. But it can be some of the most difficult changes you make can be some of the most hopeful and strong decisions that you make.
Thanks, Kim. And we had a question earlier from Kim Pierce for Isabel. Is there one thing Isabel wishes she'd been told earlier on and wasn't? So I'm not quite sure exactly in which context, but is that something that you'd like to talk to Isabel?
If it's to do with anything medical, I guess I was throwing myself in so many directions at the time. I was trying to absorb so much information, either from my medical oncologist and my surgeon and my fertility specialist, that it was a lot of information. Was there anything I would have liked to know? I think the realistic chance perhaps of pulling this off, because I was looking at surrogacy and IVF and potentially so I basically, I think it was a desperate measure, and some people were honest, but some people had a different discourse about that as well. There's so many complications and layers about going down that path. So in the end, I think I had to go through that process of letting go eventually, but it was a difficult thing to engage on. Obviously, anything else about my journey was very emotional and traumatic, and I don't think anybody could have predicted what happened there. But I think, if anybody had told me that 5 or 6 years on I would be living life as I'm living it right now, I wouldn't have believed them. And I think when you experience a comeback like that, with the will to live and the will to be happy, that's all I can say, and be hopeful that this can happen for you and happen for me. So yeah.
Thank you, Isabel. So we haven't had any more sort of questions in the chat box. So, and we're actually 5 minutes over time. So in summary, women experience a unique set of problems. I guess we'll all agree on that. The issues are complex, but the thing is you're not alone. Good things can come out of a cancer diagnosis, believe it or not. You can regain your emotional wellness and accept the professional and or personal help offered. So that's the little bit of summary. We have some resources here. The Australian Lymphology Association, there's a link there. So when you get the recording of this webinar, you can refer to these. The Lymphedema Action Alliance, which is a new group, which is doing a lot of good work. Yvonne's book, One Piece of Advice, you can go to her website and actually purchase the book. She gives 10% of the proceeds to Cancer Council, so that's good for us. And then there's some other links here. Oncology News Australia. Now there was a really good article that Kim Hobbs had in there just in the recent edition, so there's the link if you want to go and read Kim's article. It's a great article. And support groups. We had a few questions about support groups, so if you want to find out, if you ring, we're now the Cancer Information and Support 13 11 20, and you can have a chat with the girls there and they can point you in the right direction for joining or supporting or starting up a support group in your area. And then the Cancer Information Support, there's the phone number for you, and there's Lifeline. If there's anything that's come up for you during the webinar, please call them and have a chat if you don't have anybody to talk to. So we're going to have an exit survey come up, and we'd love you to participate. It helps us developing our webinars, that we're doing the right thing, that you're hearing the right things you want to hear, and moving on for the future so we can keep on presenting them for you. And the recorded webinar will be emailed out to you in the next sort of 3 or 4 days and also uploaded on our website. So thank you to everyone involved. Isabel, Jeanette, Kim, Yvonne, thank you so much for your time and for sharing with so much. Oh, I can't think of even the word. You've just shared so much of your stories with us tonight. So thank you very much. And have a great night, everybody. Bye.